So obviously, if you want to start that switch from dealing with COVID as a public health emergency and instead start dealing with it as we would the flu, that means lifting restrictions. So let's use a concrete example. California, where you are, its statewide mask mandate is set to expire in 10 days. So do you think that should be allowed to expire?
So I anticipate, given the amount of COVID that we're still seeing and the percentage of people that are still testing positive when we run a test, that it's probably too soon to lift the restrictions around the masks. And the reason is that people can be asymptomatic and still spread the disease. And so the only way to protect against that is really to have people wearing masks, particularly indoors, which is where you're more likely to spread it. But however, when we have less disease prevalence, so for example, when we see influenza percent positive tests actually drop below a certain threshold, we can say that actually we're out of an epidemic period. And I think we can do that with COVID as well. And so if we can determine what that threshold is, we can actually tell people you actually don't need to wear those masks, at least at a given time. And if we start seeing the prevalence go up, we can tell people actually it's time to start wearing those masks again. I think it's a little too soon. We're still in the Omicron surge. Can't wait till a month or two when we're finally out of that.
And what about schools? I mean, I saw that some San Francisco physicians, where you are there, were circulating a petition calling for state leaders to start going down the path of removing COVID restrictions in schools. Is that too soon, do you think?
So I think actually the time is ripe to have that discussion. And again, to come to a consensus about what thresholds we think we can use in terms of community transmission to allow us to be able to start dropping those restrictions. And that's where, clinicians like myself that practice in hospitals or practice in clinics, teachers, schools, school districts, policymakers need to come together and come to a general consensus and then be able to provide that level of clarity to the general public. Because right now it's quite confusing around the various recommendations for testing, isolation, for quarantine, and for therapeutics. And we need to be able to provide, again, the thresholds by which we need to have the masks on, when can we take them off. And I think this is actually exactly the right time with the Omicron surge waning to be able to say, this is what the next steps look like.
And the next step towards, the way we measure COVID, that might be changing as well. I mean, some jurisdictions are going down the road towards switching to a system more like the one we use for the flu, for example, that would estimate cases based on a statistical sample rather than counting each infection. Is it time we start switching to that?
I think actually we are moving in that direction. And the reason I say that is, with influenza, we typically do a large, basically public health level testing, population-based testing, initially to determine, is the disease present and is it increasing? Once we know that, we don't need to continue mass testing. What we then do is we pivot and say, we're going to test people who actually we're going to do an intervention on. For example, I'm going to admit you to a hospital. I'm going to potentially give you a therapy. Those are people that we do testing on. But the rest of the people who develop symptoms of influenza, we'll tell them to isolate, and we give them the time that they need to isolate. Unless they get sicker, they don't need a test. And I think that's actually the move that we need to make, the pivot we need to make with COVID-19 as well. It's going to allow us to be able to direct the tests where they're needed, to use the tests for public health purposes when they're needed, but then directing it to the individual patient so that we actually have overall enough tests and enough clarity for people so that they're not confused about, should I run a test or not, and do I need to do it every day, literally, in some cases.
Well, listen, all of this is giving us a ray of hope as we perhaps see the end to this, at least in terms of dealing with a pandemic. Dr. Stephen Parodi, thank you so much for being here with us. Really appreciate it.